Eczema is a broad term for a particular type of rash. The medical term for eczema, and the most common type of eczema, is atopic dermatitis. Atopic diseases are things like seasonal allergies, asthma, food allergies, and eczema is just the skin version of that. It's basically an allergic reaction, but it's not as simple as just taking something away and then the allergy will go away. Eczema is a little more complicated than that. So like most atopic diseases, eczema comes and goes. We call the flares exacerbations, and there are a lot of different things that can trigger eczema exacerbations. The most common foods are going to be milk, soy, egg, nuts, and fish. Some common clothing items, wool can be especially exacerbating for eczema, and then really high fragrance laundry detergents can also cause eczema flares. And then some environmental conditions that can cause eczema flares are dry climates, even air allergens. So if you have seasonal allergies and your seasonal allergies are triggered, that can actually trigger eczema as well. And then excessive sweating. But even if you get rid of all of those things, sometimes it doesn't fix the eczema entirely. It's a complex process. So the mainstay of treatment for all atopic illnesses is control. We can't cure them very easily, and so we have to try and control them and prevent flare-ups. There are two main ways to control eczema. The first is hydration, and the second is moisturizer. As far as hydration is concerned, we recommend that children with eczema get a bath every day. And if your child has severe eczema, you may want to consider adding a little bit of bleach to the bath just to prevent infections. You're going to want to talk to your provider about whether that's necessary or not too. There's also a more intensive way of hydrating the skin called wet wraps, and you're going to want to talk to your provider about whether that's necessary or not. Those are generally used for severe eczema. As far as moisturizer, you want to find a bland, unscented moisturizer. The classic one is Vaseline, but other brands such as Cetaphil, Eucerin, Aveeno, Aquaphor, and Vanicream are all fine. Just make sure it doesn't smell very good. The fragrance can actually trigger eczema. And you should do both the bath, the hydration, and the moisturizer every day, even if your kid doesn't have a rash. It helps to prevent the eczema from coming on. It's very hard to eliminate triggers, and it's kind of beyond the scope of this video. So if you have any questions about elimination diets or skin testing, you can ask your provider about that. If your child's eczema is mild, you can purchase a little bit of 1% hydrocortisone cream and put it on twice a day. Try not to put steroid creams on at the same time that you're putting the moisturizer on. They can actually interfere with each other. And you don't want to use that over-the-counter cream for much longer than 2 or 3 weeks without talking to your provider about increasing the strength of the steroid. Also be very careful around the eyes with steroids. If your child's eczema is a little bit more than mild, you're going to want to talk to your provider about getting an increased strength of steroid. You just use the steroid until the rash goes away, kind of like whack-a-mole, and then you stop. If your child is very itchy during these flares, you can use an antihistamine such as Zyrtec or Benadryl to help with the itching. So these aren't anabolic steroids like weightlifters and bodybuilders use. These are anti-inflammatory steroids, so same name but very different medicine. They can be strong, but generally the ones we use on the body on the skin tend to be lower dose and almost never end up in the systemic circulation. That being said, there are some side effects from long-term steroid use. So if you use very high dose or very high potency steroid for a very long time, more than a couple of months, it can thin the skin. We actually do that on purpose for some conditions. And if you're still concerned about those side effects, you can talk to your provider about alternatives, but they generally are more expensive and they don't work as well. Steroids do work really well for eczema if you use them appropriately, and generally any side effects are going to be much less concerning than the complications that eczema can cause.